In the previous class, we have discussed there are 8 patterns of liver. 2 patterns are the pattern of deficiency, and 6 patterns are the excessive energies. हमारे लिवर में ऐसे 8 पैटर्न पाए जाते हैं। पहले 2 पैटर्न कमजोरी के होते हैं और बाद के 6 पैटर्न अधिक ऊर्जा के होते हैं। सो फर्स्ट विल स्टार्ट अवर डिस्कशन विद द पुअर पैटर्न, वीक पैटर्न। So in the weak pattern, the pattern number 1, the deficiency, इसका नाम है the second pattern will be liver yin deficiency. So this is the liver blood deficiency or the deficient pattern. Deficiency is also the deficient pattern. 2 are deficient pattern of liver. So let's talk about the liver blood deficiency. सबसे deficiency की बात करेंगे। So when the person is suffering with the vertex headache on the top of the head, the person is having headache here because blood is not reaching. So this is the pattern of deficiency, because as per the meridian concept, we know the internal reaching on the D20, हमारे लिवर मेरिडियन का अंदरूनी पाथ गवर्निंग वेसल 20 तक जाता है। So most of the time it's a deficient pattern, but sometime only it might be excessive pattern. Sometime it might be pattern, we are telling that the pattern of excessive energies. Right now we are talking about this, the pattern of deficiency, right? So the person is suffering with a vertex headache. The suture will be disturbed. We have to lose this suture. So we will tell the patient lie down, and after that we will release this entire suture. In the previous class, we have discussed that we have to separate the suture. First, we have to keep the 10-finger hold. Then we have to release the suture. We discussed already, so I'm not repeating that on the day 3, maybe day 23. When the person is suffering with the liver blood deficiency, जब किसी व्यक्ति के अंदर liver blood deficiency होती है, so the second cluster pain, the pain in and out around the eyes. So when there is a pain in and out around the eyes, this is also might be because of the liver blood deficiency. Got it? So 2 types of the pain. Number 1, vertex headache. Number 2, the pain in and out throughout the eyes area. The person will be suffering with the giddiness because blood is not reaching to the brain. Numbness in the hand and feet. And insomnia. We will understand insomnia in 2 ways. This is called 9 to 11. This is called 1 to 9 pattern. The patient is sleeping at the 1 a.m. in the night and getting up morning 9 a.m. रात को 1 बजे सोता है व्यक्ति और सुबह 9 बजे उठता है. दिस इज कॉल्ड 1 to 9 पैटर्न. Either person is sleeping purposefully or he's not having getting sleep. He's going on the bed, but for 1 hour, 2 hour, 3 hour, just turning on the bed here and there, not getting sleep till the 1 a.m. in the night, then getting good sleep. Once the getting the sleep, then okay, sleeping properly. It is called 1 to 9 pattern. Many intellectual person are suffering with this pattern because many intellectual person are doing work in the night. When they are free, they eating the dinner, then doing the study, working on the computer, laptop, replying their messages, or watching the Instagram, or making the video for Instagram, right? So now posting the video on the Instagram. This is a very good time. We can post the video peacefully. But you have to do this thing little early. So night, I have seen many doctors. They are sleeping late at night. They are telling, oh, I'm having neck pain. Oh, I also having pain in the arm. They are doctors. So they are coming to the acupuncturist. Can you treat my neck pain? I have some compression in the neck. In the X-ray, there is cervical spondylosis. And even I feel numbness in the hand. If I'm holding something, sometime I'm feeling that it will fall down. So do you have treatment for cervical problems? But if we want to treat these types of the patient permanently from the root, then we'll ask, okay, what's your time you're sleeping? I'm sleeping by 1 a.m. What time you're getting up? Okay, I'm getting up by the 9 a.m. in the morning. It means there is chances this is the liver blood deficiency. तो रात को 9 बजे सो के सुबह रात को 1 बजे सोना और सुबह 9 बजे उठना. So one patient came to me. I asked, the patient told me, I feel giddy. Okay, you are feeling giddy. Maybe blood is not reaching to your head region. What time are you sleeping? I am sleeping by 1 a.m. in the night. I thought, oh, wonderful. I got the diagnosis. One more question. What is the question? What time you are getting up? What time you are getting up? I get up by 6 a.m. He's getting by 6 a.m. Then what I thought, okay. I asked, okay, if you get why you are getting up 6 a.m.? Then I am asking, why you are getting up at 6 a.m.? He told, because my kids are going to school, I have to prepare the tiffin. Even feeling sleepy, but I have to get up. There is no any second chance. So sometimes we have to cross verify. Okay, if the person is having full freedom, then I ask, okay, if you have full freedom, what time you get up? Then she told, might be 8:30. Oh, liver blood deficient. Right? So in this way, we have to do the cross verification. One female is telling, doctor, I feel giddiness and very low blood during menstrual time. Okay, headache, because we know head is supplied by the liver, even uterus supplied by the liver. And then she told, I also have neck pain and little numbness in the arm. Done, diagnosis done. Neck pain, numbness in the arm, and she's having low menstrual blood, lesser bleeding during the menstruation. Right? So in this way, many times person are feeling some of the other these symptoms. These symptoms are written here. ये सारे लक्षण यहाँ लिखे हुए हैं. देखिए, giddiness, numbness in the hand and feet, cramps and the spasm of the muscles, your nails will be weak, insomnia, less or no menstrual bleeding, and the dry skin, right? These are the sign of liver blood deficiency. Got it? So now person might be having three types of the problem. Number one, pain in and out of the eyes. Number two, vertex headache. And number three, we already have discussed in the previous class. हम पहले की क्लास में समझ चुके हैं. The left side headache is due to liver blood deficiency. The headache on this. In this way, now we have to do the planning of the treatment of liver blood deficiency. Is it clear? So now you are able to understand. The pain and numbness will be in both arms or any one arm. The pain in and out of the eyes in any eye, right eye or the left eye. दोनों आंखों में इन एंड आउट पेन हो सकता है, दोनों आर्म में और दोनों फीट में नमनेस आ सकती है, लेकिन हेडेक लेफ्ट में होगा. तो आप पहचान लेंगे अभी लिवर ब्लड डेफिशिएंसी का पेशेंट. विल यू एबल टू डायग्नोस व्हाट इज द ट्रीटमेंट नाउ? सो लेट्स प्लान द ट्रीटमेंट. चलिए अभी हम इसका ट्रीटमेंट प्लान करते हैं. You have to, those who are very new and not knowing the meridian, they can do the treatment in the sujog meridian. Sujog meridian are found in the fingers, right? They can see the chart of the sujog meridians and they can do the treatment. Let's see here. So now we are doing the blood formation. अब हम blood का निर्माण कर रहे हैं. कहाँ पर? लिवर में. We are doing the blood formation in liver. So this is the treatment which is written here. This is the treatment for low menstrual bleeding or no bleeding, giddiness, vertigo. If you want to make your nails beautiful, नाखूनों को अच्छा बनाना है, you want to treat any of these conditions, the person is having numbness in the arm, dry, for these all conditions, treatment. I told you yesterday, whenever you want to make the blood, always points, urinary bladder 17 and spleen 10. These 2 points are the blood. ये 2 point हमारे blood को बनाने वाले special point है, right? So whenever we want, हम blood को बनाना चाहते हैं, तो पहले तो हमें खाना खाना पड़ेगा. We have to eat the food. We have to take, and so making the food chi. So let's strengthen. So we have point of the spleen. Urinary bladder 20 is the Baksu point of a spleen. This is the Baksu point of a spleen. And spleen 6 and stomach 36 are one of the great point. They are strengthening spleen. तो बहुत ही गजब के पॉइंट हैं जो हमारी स्प्लीन को स्ट्रेंथन करते हैं. So ultimately we have to take these 3 points to strengthen the spleen. We are eating, we will able to convert it in the form of food chi. चलो हमने स्प्लीन को ठीक कर लिया. अब हम बात करते हैं लिवर की, because we want to improve the liver also. Why we have to improve the liver? Because there is a liver blood deficiency. Many diabetic patients are very commonly suffering with the liver blood deficiency. So many diabetic patients will come to you, doctor, I feel giddiness. Whatever you do, giddiness will not go away. You do the treatment, but still you are bothering, oh, why the giddiness is not going? You will see the books, the point of giddiness. You are putting the point, giddiness will not go. Why? Because they are taking the medicines, it damaging their liver, so it's doing the liver blood deficiency. वो जो डायबिटीज वाले जो दवाइयां खाते हैं उनके माध्यम से लिवर डैमेज होता है और उससे होती है लिवर ब्लड डेफिशिएंसी. नाउ hemoglobin might be 13, even the 14. Remember, if you tell the patient, okay, you are having liver blood deficiency, patient will tell you, doctor, I have 13 hemoglobin. Because blood means only hemoglobin. But in the acupuncture, we have liver blood deficiency, we have heart blood deficiency, right? So our blood deficiency is not the hemoglobin. Our heart blood deficiency is not the hemoglobin. Our liver blood deficiency is not the hemoglobin, right? Our blood deficiency is very different. Means liver is having poor blood, and wherever the liver is providing the nourishment, that all area the poor blood availability. Like liver is providing nourishment to our nails, so poor blood to the nails, so nail will be very dry. Liver is providing nourishment to the head region, so there will be memory loss, forgetfulness. एक बड़ा ही कॉमन साइन होता है कि अभी आप घर में ताला लगाया और थोड़ी दूर गए, अरे ताला लगाया कि नहीं लगाया. ऐसा तो वैसे नॉर्मल भी हो सकता है किसी को, लेकिन लिवर ब्लड डेफिशिएंसी में हर चीज, ओ वेदर आई हैव डन दैट वर्क और नॉट, ओ मे बी आई हैव नॉट स्विच्ड ऑफ माय गैस, ओ आई हैव टू रीचेक, बिकॉज it's making them out of the present current awareness. If there is a liver blood deficiency, it's making them out of awareness, no awareness. They are forgetting very fast, memory loss, giddiness is the very common sign, right? So when the patient is taking the medicine of diabetes, they are suffering with the giddiness. Until and unless you treat the liver blood deficiency, you will not able to treat the giddiness. आपको उनके लिए, जैसे वो बोलते हैं कि मुझे चक्कर आते हैं, अच्छा कंधों में भी दर्द होता है क्या, हाथों में भी numbness आती है क्या, whether you suffer with the numbness in the hand or you having neck pain, yes, do the treatment of liver blood deficiency and it's a wonderful, even the cervical spondylosis will go away. Whether in the X-ray there is a degeneration, but this is the treatment of degeneration. This is the treatment of shoulder pain, neck pain, arm pain, numbness of the arm, right? Numbness in the arm. Blinking eyes is not the liver blood deficiency. Blinking eye will come later on. That is liver bend. That is not the liver blood deficiency. Okay. So right now we are talking about the liver blood deficiency. In the brain, blood is not reaching in the sufficient quantity, sufficient amount, right? So there is a memory loss. It's very common with the females. Why? It's common with the females. Suppose female is not taking proper nutrition. Whether she is taking proper nutrition or not, but every month there is a menstrual bleeding. So she is losing the blood, but she is not refueling herself. Then there is a liver blood deficiency and she will be having more symptoms. So there are more chances of the liver blood deficiency in the female. आपके पास कई पेशेंट आएंगे, लेकिन ज्यादातर फीमेल को होगा, मेल को भी हो सकता है, बट ज्यादातर फीमेल को होगा, क्योंकि फीमेल नेचुरली ब्लड को थोड़ा सा लूज करती है. वैसे तो menstrual bleeding is a wonderful cleansing method, cleansing procedure. Due to the menstrual bleeding, because of the menstrual bleeding, it's making the female beautiful, soft, and delicate, because it's a detoxification. But ultimately, she has to refuel. but she is not refueling herself, then will suffer. So now after doing the treatment, UB17 and spleen 10 spleen, we have tonified the spleen. Now we will also treating the liver, maybe some medicine, diabetic medicine or some other medicines, or maybe not the medicine, it's your lifestyle is disturbing the liver. Maybe you are not doing any exercise, you are just having sedentary lifestyle, आपकी लाइफस्टाइल में कुछ भी एक्सरसाइज नहीं है या खाने पीने में गड़बड़ी है. So now we will also activate liver. So UB18 is the backsu point of liver, and liver 8 is the mother point of the liver. Now finally we will activate kidney. Kidney 3 is the very good point of kidney, and urinary bladder 23 is the backsu point of the kidney. So this is the backsu point of the kidney, and this is the source point of the kidney. So with the help of these point protocol, we have activated the kidney, liver and spleen, and the special point of blood. And finally, we will add two more points. CB4 is the universal tonification point. CB4 is universal tonification point. It tonify everything. CB4 को हम हर चीज को टोनिफाई करने वाला पॉइंट कहते हैं. CB4 is tonifying yin, yang, blood, chi, fluid, everything. CB4. CB4 is the point he tonify everything. And pericardium 6 is the very good point for chest cavity because event of pumping of the blood is happening in the chest. Ultimately, we have made the final protocol. हमने final protocol तैयार कर लिया. As soon as we do this treatment to the patient suffering with the liver blood deficiency, so this is the treatment protocol. Oh, we have not added the kidney point here. UB17, spleen 10, spleen 6, 20, kidney 3, UB23. Then this is the point protocol. With the help of this, we can treat the liver blood deficiency. Liver blood deficiency means we can treat the cluster head, eye pain. We can treat the giddiness, numbness of the hand and feet, muscle cramps. अब कभी कभी आप पूछते हैं, कई बार लोग ग्रुप में मैसेज करते हैं कि पैरों की मसल में क्रेम्स आ रहे हैं, प्रोटोकॉल बताओ. अब कैसे बताओ, आप समझ रहे हैं मेरी बात को. इट्स समटाइम इट्स बिकम डिफिकल्ट टू रिप्लाई द मैसेज. मैनी मैसेज कमिंग लाइक दिस कि एक पेशेंट की को हाथों में नमनेस आ रही है, पॉइंट प्रोटोकॉल बताओ. बिकॉज इफ द नमनेस इन द हैंड, there might be few more reasons. The one reason is liver blood deficiency. Even the vertex headache is due to the liver blood deficiency, and the left side headache is due to the liver blood deficiency. On the day 2, when I was discussing the right side headache, many of you asked, okay, then what is the treatment of left side headache? हमने उस दिन समझा था कि राइट साइड के हेडेक का क्या ट्रीटमेंट होगा. भूल गए होंगे तो डे 2 का वीडियो देख लेना. उस दिन हमने लेफ्ट साइड का नहीं डिस्कस किया था. आज हमने लेफ्ट साइड का भी डिस्कस कर लिया, वर्टेक्स का भी, और क्लस्टर पेन अराउंड द आईज का भी. नाउ वी आर मूविंग टू द नेक्स्ट पैटर्न, दैट इज कॉल्ड लिवर yin deficiency, because I told you in the liver we are having 2 deficiency pattern. हमारे लिवर में 2 प्रकार के डेफिशिएंसी पैटर्न होते हैं. ओके, तो पहले हम यिन की बात करते हैं कि यिन क्या होता है. व्हाट इज द यिन? व्हाट इज यिन? यिन इज द वेरी इंपॉर्टेंट थिंग. अब आप देखिए, मैं आपको पहले एक यिन का उदाहरण देता हूं. लेट्स गिव द एग्जांपल ऑफ यिन. You can see the land. In the land, there is no water because water is not raining. No rain. What is the condition of land? Can you see this? ये लैंड की क्या कंडीशन होगी? So this land we can tell yin deficient. Yin deficient and no water in the land. And if there is no water or the less water, comparatively the land will be hot. That is called empty heat. Empty heat. गर्मी बढ़ जाएगी थोड़ी सी. If we put the water here, then automatically it will cool down. It will cool down. अब ये कल्पना करिए कि अगर आपका ब्रेन ऐसा ही हो जाए तो क्या होगा. Suppose your brain is not getting enough yin. Your brain is not getting enough nourishment. Why your brain is becoming like this? Because you are not sleeping or you are working too much on the screen. आपको ऐसा ब्रेन चाहिए क्या? कटा फटा टूटा चाहिए क्या? Anyone want this? No. If the brain is happening this type, then we will tell, oh, this person is suffering with this person is suffering with the Alzheimer's. Alzheimer's समझते हैं आप? Alzheimer's, the disease. The person may be forgetting many things, remembering something. Person may be telling, okay, in the childhood, I was very naughty, and he will be remembering all the events of the childhood. But he will forget you. You met just one day earlier and he will forget you. आप अभी एक दिन पहले ही मिले थे उससे. हाँ, अमिताभ बच्चन की जो मूवी आई थी, क्या नाम था? ऊंचाई, है ना? So Alzheimer's means there is no nourishment to the brain, no nourishment to the liver meridian, wherever the liver meridian is going. Suppose liver meridian going to the eyes and no water in the eyes, then eye will be dry eyes. Got it? So in this condition, what will happen? क्या होगा? So let's see here. We are asking the liver, why liver you are dry? Hey liver, you are very much important. Hey liver, we have given you responsibility to supply the brain, and brain depends on you. Then why you are too much dry? Liver will tell, what can I do? My mother is dry. My mother is having deficiency of the water. मेरे मदर के जो पानी के तालाब सूख गए हैं, तो जब उसके पास ही पानी नहीं है तो मुझे कहां से देगी वो? My mother is not having availability of the enough water. So how will I get the water? Then liver will become very hyper. Liver will become angry. So what are the signs? Because liver is not able to cool, not able to cool down. So the person will be suffering with the headache. अब व्यक्ति को होगा सिर में दर्द, headache. So now if you remember, the person is suffering with the headache. The person is having impotency, napunsakta, impotency. Why? Because for good sexual performance, you should have some oil in the body, you should have some jing in the body, you should have some yin in the body. आपके शरीर में yin नहीं बचा, जब फ्यूल नहीं है तो पोटेंसी कहां से रहेगी? तो पर्सन इज सफरिंग विद द impotency. So impotency and anger coming together, shouting anger and the impotency. So remember one thing, if the person is having nature of shouting anger, then there are greater chance to become impotence. अगर व्यक्ति को एकदम से गुस्सा चढ़ता है, तो उसके नपुंसक होने की संभावना है। और अगर फीमेल को एकदम से गुस्सा चढ़ता है तो उसको मेंस्ट्रुअल प्रॉब्लम होने की फुल टू पॉसिबिलिटी है। आई हैव सीन मेनी मेल एंड फीमेल्स, if they are having shouting anger, so they are suffering with some or the other gynecological problems, right? So first we have to refuel them with the water, with the yin. The other sign, there is a dizziness, vertigo, because liver is connected with the kidney yin, so there is sign of the like tinnitus, even the deafness, कानों से कम सुनाई देना, and yin deficiency, because there is a no water, so it will bring dryness. So dry mouth, dry throat, dry eyes, dry skin, everything will be dry due to yin deficiency. इसके कारण हर चीज ड्राई होने लगेगी. So when you want to treat these conditions, we have to see the kidney also, and we have to do the proper nourishment to kidney also. Because when the kidney is not sending enough water, then liver become very hot. So now we have to expel the heat and we have to cool down the liver. हम ऐसे व्यक्ति को क्या कर सकते हैं कि रोज रात को सोते समय थोड़ा सा कैस्टर ऑयल लीजिए. टेक सम कैस्टर ऑयल मिक्स विद द कोकोनट ऑयल. कैस्टर ऑयल जितना ले रहे हैं उसका 3 गुना कोकोनट ऑयल मिलाकर रख लीजिए. मिक्स द कैस्टर ऑयल 10 ml plus coconut oil 30 ml. This ratio, you can change the ratio, like 100 ml castor oil, 300 ml coconut oil. Coconut oil should be 3 times more. And take little, near about very little, half a spoon, and put in the DU20. DU20. Every night before sleep. Or anytime, but night is better. Because these patients also struggling for sleep. अगर नींद अच्छी आ जाए तो बात ही क्या, फिर तो yin डेफिशिएंट कैसे होगा. नींद नहीं हो रही है या तो हो नहीं पा रही है या करवटें बदल रहे हैं. आई हैव सीन मेनी पर्सन दे वांट टू स्लीप बट दे आर नॉट एबल टू स्लीप. देन आई एम प्लेइंग समथिंग ऑन द मोबाइल. सच में इतनी इतनी तक प्रॉब्लम होती है. आई हैव सीन मेनी young patients, young persons, they are going on the bed by the 11 p.m. till the 2 a.m. in the night. They're just turning right and left. They're not able to sleep. Not. What is the real treatment of this? What is the real treatment of this? Number one, apply the coconut oil and the castor oil combinations. Number two, do the massage of feet before going to sleep, and use these points, which we are going to discuss now. We have to expel the unwanted energies from here. Then only person will calm down and will go for sleep. Otherwise, person will not able to go for sleep. तो इसके लिए अब हम क्या करेंगे? So these person, patient will tell you, doctor, I am suffering with impotency, napunshakta, erectile dysfunctions. What we have to do? We have to tell the patient, please sleep properly, sleep minimum 6-7 hours, and during the night time. He will tell, doctor, I am sleeping 3 hours in the night, 2 hours in the day. No. The night sleep is very much important, and especially the sleep between 11 to 3 is very much important if you want to nourish the liver. Why? Because 11 o'clock is the time of gallbladder, 11 to 1. And 1 to 3 is the time of liver. So the sleep between 11 to 3 is very much important if anyone want to keep your brain wonderful. Wonderful because liver is supplying the brain. आपको आपने देखा होगा जब भी किसी को एल्जाइमर्स होता है, डिमेंशिया होता है, कभी भी इडियट्स को नहीं होता, इडियट को, गधों को नहीं होता, किसको होता है? सुपर डुपर इंटेलिजेंस को. So if you are a super duper intelligence, then it's a warning signal for you. If you are a dull minded, then just free. अगर आपका दिमाग कम चलता है, कुछ समझ में नहीं आता, तो नहीं होगा एल्जाइमर्स और डिमेंशिया. डिमेंशिया, एल्जाइमर्स और ये बड़ी बड़ी जो ब्रेन की बीमारी होती है ना, ये ज्यादातर इंटेलेक्चुअल लोगों को ही होती है. आप देख लेना, you do the survey, Alzheimer's, they are very very intellectual persons, right? So these persons will be suffering with a liver yin deficiency. So now let's go through with the symptoms once again. So headache, impotency, shouting anger, dizziness, vertigo, tinnitus, ringing sound in the ear, dryness in the mouth because dry, everything is dry, and dry eyes. So please be a cool personality. एक cool personality बन के रहिए. और अगर आप cool personality नहीं है तो yin को मजबूत करिए. Otherwise it will destroy your life. Got it? The meaning of cool personality is not the cold person who is not doing anything. No. You are always alert. You are very always aware. But on the same time, you are cool-minded. If we look at the head reason, so look at here. We can see the liver yin deficiency creating pain on the right side. So this is the liver yin deficiency. Sometime due to the liver yin deficiency, there is an empty heat appearing. Then it's doing the liver yang rising. That is also the right side. Okay. तो चाहे लिवर यांग बढ़े या लिवर यिन डेफिशिएंसी हो जाए, इसका दर्द आपको और राइट साइड में होगा. We have to use multiple point of the gallbladder meridian because we will use local point of the gallbladder meridian. We can see here, this is the gallbladder meridian, right? We can see here the gallbladder meridian starting from the corner of eyes. Then there is the gallbladder 2, gallbladder 3. We can see on the, this patients might suffer with the temple headache. ऐसे लोगों को यहां पर दर्द होता है, इस पार्ट में. जो लोग ज्यादा गुस्सा करते हैं ना, उनको यहां दर्द होता है. लिवर यिन डेफिशिएंसी और लिवर yang rising, they suffer with the temple headache. So we have to use multiple point here. All the point of the gallbladder meridian we can use here. We can see this is the gallbladder meridian. So we can use gallbladder 8, gallbladder 9, gallbladder 10, gallbladder 11, gallbladder 12, multiple local point around the ear we can use. हम कान के आसपास पाए जाने वाले multiple point को use कर सकते. Even we can use the gallbladder 20 point, which is a wonderful point of expelling the headache or the bind को निकालने का बेहतरीन point है. And even we can use gallbladder 31. Gallbladder 31 is one of the great point who expel bind from entire body. हमारे संपूर्ण शरीर से बिंड को और दर्द को निकालने वाला. So ultimately we have to use multiple point of the gallbladder. We will sedate all. हमने इनको सेडेट कर दिया तो ये हमारा पेन कम हो जाएगा, ये पूरा का पूरा गॉलब्लैडर मेरिडियन काम डाउन हो जाएगा. दिस एंटायर गॉलब्लैडर मेरिडियन विल बी कमिंग डाउन. द टेम्पल हेडेक विल गो अवे, right? Now sometimes these patients also might suffer with the cluster headache, but don't get confused. क्लस्टर हेडेक में इनको भी कभी कभी यहाँ दर्द होता है, इन एंड आउट. But right now we can see here, okay, so what to do, how to make the protocol, हम कैसे इसका इलाज करेंगे. So let's see now. So this is the protocol. Number one is, yesterday I told you, whenever you want to improve the yin, there is a wonderful formula which is called 6666 formula. You can see in this image, in this diagram, this one. Kidney 6, spleen 6, pericardium 6, and the heart 6. This is called 6666 formula to improve any type of yin. किसी भी प्रकार के yin को improve करता है. Got it? With that, we are using kidney 3 point to cool down the kidney, liver 8 point to nourish the liver. अब हमने ये बहुत ही बेहतरीन काम किया. हमने यहाँ पर हमने क्या किया कि we are cooling down the kidney, we are strengthening the kidney, and we are cooling down the liver. हम ये दो काम एक साथ कर रहे हैं क्योंकि हमने पहले ही आपको बताया था कि जब कभी भी किडनी कमजोर होती है और एक सही नरिशमेंट प्रोवाइड नहीं कर पाती है तब ये प्रॉब्लम होती है. Let's see here. So we are taking the kidney 3 point to strengthen the kidney, that is the source point of kidney, and we are taking the liver 8 point, which is the mother point of liver. Ultimately we are making this chain stronger, we are making this supply stronger, and then we are using 6666 formula. Kidney 6, spleen 6, pericardium 6, heart 6. Excellent formula to improve the yin deficiency. yin deficiency को ठीक करने का बहुत ही बेहतरीन फॉर्मूला है. Now, but the person is suffering with a headache. अब व्यक्ति को तो सिर में दर्द हो रहा है. What to do? We'll sedate few points. हम कुछ points sedate करेंगे. We will sedate the liver 3. Liver 3, one of the great point to calm down entire liver channel. We'll sedate triple burn of 5, UB2 and TIA. इनका मैं इफेक्ट बता देता हूं आपको क्या क्या होता है. Number 1, liver 3. Liver 3 is the distal point of head. Distal point of head. Any problem is happening in the head, especially the side of the head. Liver 3 is one of the great point. अगर कभी भी किसी को सिर के साइड में दर्द हो तो हम लिवर 3 को डिस्टल पॉइंट की तरह यूज करते हैं. नंबर 2, UB2 is the local point. UB2 हमारा local point है. If there is any problem is happening in the head region, we can always choose the UB2 point. UB2 point is also one of the great point, and we can tell this the distal point, right? UB2. So we have taken 2 point here. So if we draw the picture here, like this is the picture of the head region. UV2 located on the medial corner here. This is the location of UV2. Got it? And liver 3 is the very good distal point of entire this area. Now regarding the triple worm 5, triple worm 5 is very good point for the side of the headache. This is also the distal point of side of the headache. तो ट्रिपल वर्मर 5 को भी ध्यान में रखिएगा. So we can see here in this image, the triple worm meridian is supplying the side of the head region. We can see the triple worm meridian. This is the triple worm meridian. So triple worm 5 is one of the great point for this area. We have taken triple worm 5. We have taken liver 3 for the side area. We have taken UV2. And finally, we have taken Taiyang. Taiyang means this depression here. यहाँ पर जो खड्डा होता है, ये बहुत ही स्पेशल पॉइंट है Taiyang. So Taiyang is the special point here. So ultimately 4 point, Taiyang, sedate, UV2 sedate, then liver 3 sedate, triple worm 5 sedate. As soon as you sedate this point, the headache will go away and sleep will be coming back. नींद आने लगेगी. तो इनको सेडेट कर दो और बाकी के पॉइंट को टॉनिफाई कर दो. We can choose some point from this gallbladder meridian. कुछ पॉइंट हम इसमें से, this is the gallbladder meridian, like the gallbladder 8, gallbladder 9, gallbladder 10, gallbladder 11, gallbladder 20. We can sedate some point. We can choose some point. So this is the protocol. But in this entire protocol, the most important is 6666 formula. So enough for today. So today we have discussed 2 protocol. Now protocol number 1, the protocol of the liver blood deficiency, and the protocol number 2 is the protocol of which is creating dryness, the protocol of the liver yin deficiency. Now maybe I will discuss few more lines about the liver yin deficiency. Tomorrow we'll discussing another pattern because we have 6 pattern left. So we'll discuss. So tomorrow will be tomorrow is Thursday. So now tomorrow onwards class will be only for enrolled participants. Okay. So till today is the day 5. This video I will publish for everyone. You can see on the YouTube, or I will post in the group. Tomorrow I will post the link in our final group for enrolled participants, right? So thank you so much everyone for this 5 days wonderful journey with all of you and this nice sharing and learning. Okay, see you again. Let's close the session. Bye bye.